with this month's weekly webinar. Thank you for joining today, or thank you for watching online wherever you may be. Today's webinar is titled Intensive Foster Care, What Sets Us Apart. We'll be talking about the intensive foster care program specifically, and going over information about our program. For our agenda, we'll start with some introductions of Ascentria Care Alliance as a company, and of myself and Colleen, who will be partaking in today's webinar as well. After introductions, we'll get into what IFC, or intensive foster care, specifically is, and what sets our program apart from others. We'll also go over some general information about our youth and foster parents that would be helpful for anybody to know. We will have time at the end for any questions or comments, or if you're watching this online, you're always welcome to shoot me an email and or a text, phone call, whatever may help. All my contact information is on our website. So before we get into what Ascentria does, I want to take time to introduce myself and Colleen. I'll let Colleen go first.
Sure. Hi, everyone. My name is Colleen Straub. I'm the Community Outreach Manager for Ascentria's foster care programs, so both intensive foster care and our unaccompanied refugee minors program. I've been with the agency for 4.5 years, and basically in my role, I oversee the recruitment of foster parents, but I also coordinate volunteers and donors for the program. So if there is anyone out there that wants to find a way to help but just isn't sure what that is, that's where I come in. So please feel free to reach out to me. As Ali said, you can find our contact information on the website. And after today's webinar, we will also be emailing a follow-up email with the recording of today's webinar and all of our contact info. So you can find us there as well. But thank you for listening and for being here.
Awesome. Okay, so my name is Alicia Hauk. I am the current foster parent recruitment coordinator for Ascentria. I've been with Ascentria for about a year now, and prior to that, I also interned with them while I was getting my bachelor's in social work at Bridgewater State. On top of the foster parent recruitment, I also am a case manager for children in foster care as well. So I do take some time to work with the youth. So I kind of do both sides of it. So today, Colleen and I will be discussing Ascentria and foster care. We both work for Ascentria Care Alliance. The main office is located in Worcester, but the intensive foster care is out of Brockton, Massachusetts, which is more South Shore area. Ascentria is one of the biggest nonprofit organizations in New England devoted to strengthening communities. We work to provide services to youth, families, individuals, communities that may help their lives for the better, which is actually something that's construed in our mission statement, which is pretty cool, which is we are called to strengthen communities by empowering people to respond to life's changes. Within Ascentria, there are many different programs that help us to strengthen individuals and communities. So while there are a few different programs, today we're going to be specifically going over IFC, but we do also have a URM program, which is one of our biggest programs as well. It's the only program actually in New England that provides foster care for unaccompanied refugees and immigrant children from other countries. They initiate trainings, they give necessary supports, licensing for potential foster parents, all that kind of thing, so that they can help foster the group of unaccompanied refugee youth from different countries. The program specific for today is the Ascentria Intensive Foster Care Program. So that's what we'll be talking about. So Ascentria is a fostering program partnered with DCF. We receive referrals in children from DCF, meaning that we see children that have been removed to their homes due to abuse or neglect by DCF. After receiving referrals of youth in need of placement, we work to place them within the homes of our licensed foster parents. Ascentria's program is intensive, which is what separates us from DCF foster care. And what that means is that we have a much more support for our foster parents and youth in care. The children we receive referrals for can age anywhere from toddlers to 22 years old, but our most common age is elementary and middle school years.
Okay. So I was going to speak to what we mean when we say intensive. So as Ali mentioned, this is a higher level of care than what's provided at the Department of Children and Families, but being able to support that youth to still be successful in a foster home setting rather than having to go to a residential type setting where there's 24/7 staff. So youth in intensive foster care could have a variety of different needs that make them qualify for a program like ours. So that could look like medical needs, which could be something such as a youth being wheelchair bound. We've had kids that have been in, a full body cast at a young age that required more support. Youth that have diabetes and therefore need regular administration of insulin. Could be a variety of things in that medical category. We also have youth that might have mental health needs. They could have a diagnosis such as anxiety, depression, or PTSD, especially given the trauma history that youth are coming from, having experienced abuse or neglect, that can come into play. And so Ali will talk about, the supports that we integrate into the home to help that youth be successful despite any mental health challenges. And then there could be social or emotional needs that could also qualify a child for intensive foster care. This could be things like being maybe behind in school, maybe struggling to get along with peers, maybe they are on an IEP plan at school, an individualized education plan, so that they can get support. It could be a variety of different things. Depending on age group, you might see different things in this category. And then finally, there are developmental needs that may come up. So children that might have autism spectrum disorder, children that maybe have a learning disability or a learning delay of some kind, again, a variety. So it's really a wide spectrum of needs. Sometimes there's, youth that have multiple different needs that come up. Often it's not just one thing, right? We're treating the whole child, we're caring for the whole child. But really just coming from their history of trauma and how that presents in their day-to-day life. If they do need support, if they could benefit from more support, that's where a program like ours comes in, to really specially train and support the families to care for these youth. So that's what Ali is going to talk about next.
Yes, so obviously with these children, there's a lot of different needs that may come with that. And so as Ascentria, we like to recognize that that also means providing for them in a way that is supportive and conducive to them. So we have a lot of different support systems that can be utilized to help with that. Once a family becomes licensed as a foster parent and a child is placed in their home, an Ascentria specific case manager will be assigned to the youth. The caseworker will visit the home every week to attend check-ins with the children. They will also assist in any case-related necessities like scheduling treatment meetings, foster care reviews, youth readiness assessments, and more. And that's all just fancy lingo for all the different documents and all the different check-ins and all the different tools to be utilized to ensure that the child is being as successful as possible. So other supports can also be like retrieving referrals for services like therapy, psychiatry, early intervention, education planning, things like that. So in addition to the case manager assigned from Ascentria, there's also a family resource worker, which will be assigned to the family, which is more specific to the foster parents. And their specific goal is monthly check-ins with the licensed foster parents to help with any conflicts or needs that might arise. So now there's already 2 different kinds of workers being associated with the family upon receiving a referral in your home. as a case manager myself, I can also talk more on specific needs for each family. Like I've definitely had families in the past where I would myself would perform check-ins with the youth and the foster parents. Some weeks it would be multiple times. Sometimes it would be once a week, and then sometimes it would be 3 times a week or 4 times a week or whatever was necessary. Because of that, we also have additional supports in place, like the 24/7 on-call emergency line for our licensed foster parents. So obviously, whenever I would get a call, I would answer it if possible, or if I'm working. And then if there's times when you can't get a hold of your caseworker or your family resource worker or whatever may happen, there's also the 24/7 emergency line, which can be used for a variety of reasons too. I've had people call that line just to vent, just to say, like, I'm really struggling with this and I don't know what to do, in which case we would give them advice on how to handle it. And then there's other situations where somebody gets hurt and they need to be taken to urgent care, to the emergency room. So depending on the situation, that line is always available and open for whatever the foster parent think they may need. We also do offer respite care. We've had like families go on vacation where they weren't able to take their foster children with them, in which case we would find a respite house, which is just like a short-term living situation for them to stay while their foster parents went on vacation. And then we've had emergency respite, where sometimes the foster parents just need a little break emotionally from whatever's going on in the house, and they say we need a couple days to regroup and readdress. So we'll have the kids put in a different home that is suitable for the time that the original foster parents need. And the great thing about that is that as Ascentria, we recognize that these are situations that happen all the time. And so we give 5 paid respite days to each foster parent that was licensed with us. We also offer ongoing training opportunities for foster parents if that's a route that's preferred. Anything that you might think you might need additional help with or don't quite understand or want to learn more about, we offer trainings. There is also one of my favorite supports that we have is our monthly group meetings with other foster parents. Since COVID, we've been doing them online. We've been doing them via Teams. Where just a bunch of the foster parents will hop on a Teams meeting, and everybody will just kind of chit chat about what's going on, any ideas, any advice, anything that they could possibly think of that might be helpful for each other. And I found that to be really helpful for most people, just because it helps to talk to a group that is going through the same thing or a relatively similar case. And then, of course, we also do offer payments and reimbursements for living expenses for the kids. So daily living expenses, food, clothes, things like that. Even with all these potential methods in place to support our foster parents, we still know and acknowledge that more help can be given at times, which is why we offer so many different avenues of support at Ascentria. And that is part of our intensive foster care program. These children have gone through intense situations in their life and they need additional support. And as somebody becoming a licensed foster parent, we acknowledge that it can be a lot sometimes. And so we like to offer as many different things as possible to make it easy and successful for each person that's having this happen in their life.
Great. Thanks, Ellie. I wanted to add a couple things here too. So you'll notice that we have some of these supports in bold, and I wanted to share that those are what make us distinct from the Department of Children and Families specifically. So the Department of Children and Families, or DCF, provides, this isn't the technical term, but they provide regular foster care. So the first base level of foster care. And I think the biggest difference is that they're only visiting the homes once per month. Whereas at IFC, as Ali was saying, there's a weekly visit from the youth and family specialist You also have the DCF worker still visiting monthly, and you have the foster parent worker visiting monthly. So there's a lot of different people coming into the home to support you, but that intensive case management is through that weekly visit with the youth's worker. And that's a really impactful part of what our program offers. I think the other piece of this is the stipend. We do provide an increased stipend for the cost of caring for the child, since we do anticipate that there would be more transportation being provided, maybe more specialized type things you're purchasing for the youth to meet their needs. So it's nearly twice what the Department of Children and Families provides to parents, depending on the age of the youth. The DCF rate can fluctuate, but our rate is consistent for all age groups and is twice the amount of DCF. So it really is helpful to families to have the financial support needed to care for the youth and to meet their needs. And then finally, just wanted to share that I think the great thing about Ascentria, and I've heard this from our foster parents, is we are a smaller program at intensive foster care. But the good news about that is that our caseworkers' caseloads are much smaller. So each caseworker really gets to know the family on a first name basis. That's the same person that's visiting the home weekly. The youth gets to know them, the parents get to know them. And so there is that sense of close-knit community. And I think that's a real benefit of a smaller program like ours too. So just wanted to add that. But moving on, what are our goals at intensive foster care? So with all of these supports built in and providing this higher level of foster care, ultimately our goal isn't different than other foster care programs. We all want to strive to ensure that children are achieving safety first and foremost, stability and permanency. Really, that is the goal of foster care, is to keep kids safe, to provide them some stability, and to provide them ultimately permanency. And permanency being that they have a sense of belonging and that they have a trusted adult to turn to, and that they feel at home where they're living. So most of the youth in our program do enter care with the goal of reunification with a birth relative. That is the primary goal of foster care in Massachusetts, is to reunify families, to keep families together. And so in our program, that might look like coordinating with the birth family, bringing the child to supervised visits with the birth family, and also, you know, as you're helping the youth to stabilize, that goal might become more possible for that family as the youth starts to do better with some of their other challenges. Sometimes the goal may change to adoption when reunification is not possible. So some of our youth do have the goal of adoption, in which case the foster family is usually approached first, you know, if the family is interested in adopting the child and having them legally become part of the family. That is something that foster parents could consider. If for whatever reason the family is not able to make that commitment, they can help find the adoptive family for that child and be a part of that transition. And then also some of our youth are older. We do have young adults and teens in the program, so they may have that goal of striving towards independence. So foster family kind of unofficially becomes their family, and although it might not be through a legal adoption, there are those strong bonds formed where the youth maybe goes off to college but is still visiting on holiday breaks, and that foster family is really helping them learn those skills like cooking, financial management, work ethic, finishing their education, all of those things that a foster parent can help with for youth to strive towards the goal of independence. So those are some of the goals. It can look different. It does look different for every kid, but ultimately we want the youth to have that safety, stability, and permanency. And foster parents are such a huge part of that for kids. So that is what I'll say on goals.
All right, so now that we've talked a lot about Ascentria and what it is that we're working to do, I'll take some time to dive into what we're in the process of trying to work on. So right now, one of our biggest concerns is the dire need for foster parents across the Massachusetts state. As of this past year, there's been a 75% decline in foster parent applications, while there's been a substantial uptake in the amount of foster children in need of homes. There's almost 10,000 youth in Massachusetts in need of a placement. Basic eligibility for becoming a foster parent is a question that pops up often for those that are considering adding it to their lives. Just to go over a few of the requirements, you do have to be 25 years old to apply, have a reliable source of transportation, and flexible schedule for necessary appointments. You do also have to reside in Massachusetts and be able to pass a background check. We are also very inclusive in our recruitment. We accept all different diversities and backgrounds, including races, cultures. We're open to anyone from the LGBTQ plus community. We're open to single individuals as well. Some other things asked about is home ownership. You do not need to own a home to apply. You can be renting. Additionally, there's not any specific income eligibility bracket. An individual or a family just has to have a stable source of income to apply. Becoming a foster parent starts with the basic step of contacting me on the phone or email, which again can be found on the Ascentria Intensive Foster Care website. I highly encourage anyone who's debating this to reach out to me. And that's all that we have. We do have a questions and comments. I did save some time for that for the end of the webinar, but it doesn't look like there's anything in the chat right now. So we'll go ahead and wrap up. And I just want to thank everybody again for coming, for viewing this, watching this online, wherever it may be, and taking time to learn about a program. And if you are thinking about this, reach out to me again. If you have anybody that you think may be thinking about this, spread the word.
Great. Yes, thank you all. That is all for today. I'm going to end the webinar. Thank you.